This video, I'm going to go over a speech therapy visit note. So after you have signed in and entered your time, you'll start here at the top with incident reports. If the patient's had a fall, any medication changes, visits to the emergency room, you would click yes and report that incident. If not, you can click no and move on. You'll need to enter 2 patient identification options here. And then also select patient tolerated session well and standard precautions observed. If the patient did not tolerate the session well, it's still required to click that box in the note. Just make sure in your care coordination section at the bottom of your note that you mention how the patient did tolerate the session. Next, we'll move on to the subjective. And then vitals. So you'll need to enter the patient's vitals and then their pain. Even though we have the pain scale here, you'll also need to enter that Wong-Baker form for pain as well. And that's under the Forms tab over here, which we'll get to later. Objective statement and speech therapy assessment. So you can select the items that you're focusing on, and then you can type over here, see interventions and goals. That just helps us avoid being repetitive because you'll need to comment this information under the intervention and goals tabs. So to avoid repeating yourself, you can just write see interventions and goals. This next part's important. Skilled intervention is needed because you'll need to reiterate why it's important for us to continue services if the plan is to continue, and the plan. So continue per plan of care, or if the change or the plan has changed at all, you can comment that here as well. Homebound status, we need to address this at every visit. Is the patient homebound? Which will be yes if we're seeing them. Why are they homebound? You'll need to select those boxes. Additionally, you'll have to comment. You'll have to do both of those things, otherwise it won't let you submit the note. Don't forget that you can use these quick texts. They are available. Today's notes, again, see interventions and goals, and care coordination box. You can enter any information that you feel like is important to be noted where other clinicians can see it. Then we're going to scroll back up to the top and we're going to click over to our interventions tab. There'll be a button here that says perform interventions, and then it'll let you comment on interventions performed this date. You'll need to comment on any interventions that were done during the visit. Next, we'll move on to goals. This is where you will update the status of the goals. You will need to address, you don't need to address all the goals, but you'll need to address at least a number of them at every visit. And I believe it's every 2 weeks. All of the goals should be addressed at some point throughout those 2 weeks. So this is where you'll comment on the status of the patient's therapy in progress. If you want to view the history of these goals, you can click View. And again, this is the Goals tab. So this will give you your history of that particular goal. Lastly, we're going to move on to Forms tab. This is where you will add new form and you will add your Wong-Baker, which is required at every visit, and you will add your COVID screen, which is required at every visit. Any additional forms that you may need will be here, any outcome measures, incident reports, things like that. Then you can go back to your regular visit. Scroll down to the bottom and you will be able to select your digital signature and then come back to the top, and you'll have a button to save and submit to submit your note, and you're done.